Okay, good afternoon, everyone. We are the last group of today's presentation. Today we will we will take everyone to find out why sudden death in goat occurs on the topic of goat. And this is our member. We will begin with information about this farm, then show what the problems we found and how we assess them, and conclude with a discussion about the farm management. Let's start with the farm information. This slide shows the area of the farm where 15 goats and sheep are raised with a group of geese. There are stalls and feed available, and there is open pond that connects to the pond outside the farm, which goats and sheep will come to drink water in this area. And the owner began raising these animals for about 3 to 4 years. No history of bringing new animals to the farm. And for health management, FMD vaccines are administered annually, but accepted year and deworming every month with levomycin. For feeding management, the owner led them for feed gazing and ad libitum hangula hay. Soybean hull is added daily, which has purchased last month. It was placed on the ground and the owner found it was contaminated with a fungus later. Additionally, there is a history that the neighbor have been used herbicide about a month ago and found that there are plant leaves in the farm area as well. Chief complaint is that 5 animals out of all were suddenly died. From history taking on 3rd November, the first animal died and the owner saw pre-deathly signs that there were muscle spasm and salivation. The next day, he noticed that the second animal was weak before it died. And the third animal died on the 9th November with respiratory distress, muscle spasm, and left abdominal swelling. On the 10th November, we visited the farm. On that day, the 4th and the 5th animal were died. When we arrived at the farm, we found the bodies of goats and sheep lying dead on the ground. From all of them, they are very in age, sex, and species, and all of them are well-eating animals. So we collect blood and fluid samples from the dead sheep's abdominal and thoracic regions for analysis. Then the owner bring us a goat for physical examination. His name is Big Daddy, a goat with depressed and inappetite. This is the physical examination findings. Big Daddy has mild depression and normal vital signs, but his mucous membrane color is pale. Pharmachat score was 4 out of 5, so we collect his blood for analysis. But he passed away the following day. Next, we will talk about the problem in this case. As I have already mentioned, the problem we found is sudden death. Differential diagnosis of this case can be divided into infectious and non-infectious. Infectious diseases such as coccidiosis and anthrax, and non-infectious disease such as poisoning like herbicide or even polio and encephalomalacia. So we bring Big Daddy's blood to analyze CBC, AST, ALP, and check for blood parasite, and sample from dead sheep for gram stain. Results are unremarkable. This is Big Daddy's blood results. He has leukocytosis and neutrophilia, erythrocytosis, and thrombocytosis. The ALT level was found to be low, but this is normal in luminance. The AST level is very high, and the creatinine, ammonia, and CK levels are also higher than normal, but BUN is lower than normal.
Next is necropsy result of Big Daddy. We found hemorrhage on thoracic area which caused by postmortem change. We found postmortem gravity-dependent pooling of blood on both lungs. And when we do lung floating test, the result is false. We found that he has normal heart, normal larynx and mild floating exudate in trachea. Esophagus is also normal. This is the part of abdomen. Left and right kidney are normal. But we found bulging spleen. and multifocal hepatic necrosis. Rumen mucosal sloughing and redden. The pH of ruminal content is equal to 7. The reticulum and omasum are normal. In conclusion, from the necropsy, we found 3 lesions, which are multifocal hepatic necrosis, rumen mucosal sloughing and redden, and the last is bulging spleen. The next topic is assessment. Erythrocytosis was divided into relative erythrocytosis and absolute erythrocytosis. The relative erythrocytosis, such as dehydration, body fluid chips, splenic contraction, and absolute erythrocytosis, such as polycythemia vera and renal tumor. We rule out body fluid chips and renal tumor from necrosis. We rule out polycythemia vera from hematology. Next, acanthocyte and schistocytes might be caused by liver disease, renal disease, immune-mediated disorder, disseminated intravascular coagulation, hemangiosarcoma, and iron deficiency anemia. We rule out immune-mediated and iron deficiency from hematology, and we rule out DIC and hemangiosarcoma from unseen any of clinical signs. Next is neutrophilia. It might be caused by physiological effect, chemical and drug toxicity, corticosteroid-induced leukocytosis, infection, and inflammation. We rule out steroid-induced from unseen lymphopenia. We rule out infection and inflammation from unseen left tip. And neutrophilia in this case might be caused by chemical and drug toxicity and physiological effect. The physiological effect due to the leukogram pattern were only found neutrophilia.
Increased AAT were indicated in various cells of organ. So increased CK will indicated that it was from active or resistant skeletal muscle injury. By the way, increased CK were also from fall increased by index condition. In part of renal, fall decreased BUN together with increased creatinine. The cause of decreased BUN are intra or extrahepatic shunt, chronic liver failure, malnutrition, hyperthyroidism, and diuresis. And cause of increased creatinine are fall increased, heavily muscle animal, sepsis, and developing cachexia. Rule out malnutrition, hyperthyroid, sepsis, and cachexia from unseen clinical signs. Increased plasma ammonia were divided into artifact and pathophysiology cause. The cause of artifact are delayed sample submission, delayed plasma separation, and hemolysis. And the cause of pathophysiology are cellular hepatic disease, pathosystemic shunt, overgrowth of urease, produced bacteria in the gastrointestinal tract. Rule out pathosystemic shunt from unseen clinical signs. Next, necropsy result assessment. The cause of bulging spleen are infection, liver disease, hemolytic anemia, and polycythemia vera. Rule out infection, hemolysis anemia, and polycythemia vera from hematology. The cause of multifocal hepatic necrosis are iron toxicosis, copper toxicosis, heavy metal toxicosis, monazine toxicosis, bugine algae toxicosis, herbicide, and insecticide. So we can rule out copper toxicosis from unseen anemia. Erosive and rare rumen mucosa were divided into infectious and non-infectious disease, such as boviral diarrhea, chemical erosion, and rumen acidosis. So we can rule out this infectious disease from unseen clinical signs and rule out rumen acidosis from normal rumen content pH. So the differential diagnosis in this case are herbicide, bugine algae, heavy metal, and mycotoxin toxicosis. The possible causes are herbicide toxicosis because history of using herbicide by neighbor and farm neighbors hence appear in the farm area. In the conclusion, neutrophilia from necrosis liver or excitement state, electrocyte from excitement or dehydration, acanthocyte, and schistocyte from necrotic liver, increased AST from necrotic liver, increased AST and CK from muscle injury, decreased BUN from necrotic liver, increased creatinine from muscle injury or fall increased ammonia and bulging spleen from necrotic liver, and erosive and less movement mucosa from herbicide toxicosis. So the further plan should do tissue histopathology, lumen content analysis, water analysis, and feed analysis. The last topic is discussion. In the case of animals suspected export herbicide toxicosis, supportive treatment are required for suspected animal with clinical sign of depression and apply inactivated charcoal to reduce toxin absorption, or do the nasal gastric lavage with high intake. In the part of farm management, in this case, improve feed quality that you can see on the right picture of Pangolin hay. There are soil still attached to the Pangolin roots because soil salt or pathogen and heavy metal contamination. We have recommend the farm to coat the open pond and provide clean water. Instead, management the storage room to prevent fungal and expired feed. Restrict area to animal away from near neighborhood area to prevent herbicide toxicosis from neighborhood. And finally, we would like to take this opportunity to express our deepest gratitude and appreciation to our advisor, อาจารย์สุดใส่ใจอาจารย์บรรลืออาจารย์ชวลิตอาจารย์จิตรกมล and อาจารย์สราวุธค่ะ Thank you for your attention.